All right, good morning, everyone. This is Erin McTighe with EPA Region 10. Welcome to webinar 2 of our 3-part series, Tribal Innovations and Success Stories in Healthy Homes Outreach. We're so excited that we have you all joining us today. I think we had over 200 registered and people are joining as we speak. So we're just really excited that so many folks are able to join and hear from our speakers today. Today we have another excellent lineup of presenters. I'm going to briefly go over the agenda for our hour together. Each speaker will introduce themselves in a bit more detail once I turn it over to them for presentations. But just to give you a kind of rundown of what we're going to have today for our webinar. First, I'm going to do just a few logistics and housekeeping items. Then I'm going to do a brief recap of webinar 1 and some of the learnings and exciting lessons learned from those speakers. And then I'm going to turn it over to Gillian Middlestadt, Director of Tribal Healthy Homes Network. She's going to be sharing kind of a brief recap of social marketing principles discussed in webinar 1, as well as some key information about Tribal Healthy Homes Network and their tools and training programs that they have available. And then after Gillian speaks, I'll be turning the mic over to Sydney Jansen, Tribal Healthy Homes Network intern. She was a speaker in webinar 1, is going to build on her presentation from that webinar to share some additional learnings and some key information that she took away from the research that she's been doing about 16 different Tribal Healthy Homes outreach programs. So we're excited to hear again from Sydney. And then Sydney is going to turn over the mic to Brooke Sanderson from Loudon Tribal Council in Galena, Alaska, who's going to share some really interesting, exciting work that she's doing on healthy homes outreach in her community. And finally, she'll be turning the baton over to Eileen Gagne, who's the Tribal Healthy Homes Network Technical Advisor in Training. And she's going to be sharing some examples and learnings from a few different tribal programs, in particular Tulalip Tribal work in Washington State, as well as some other training that she's supported and work by different tribes and different communities throughout the country. So we have a great lineup here today, and we will end with some discussion time as well as a few poll questions and a raffle for an Air Matters toolkit like we did last time. So be sure to be looking for that. So just in terms of housekeeping, just like last time, please feel free to ask questions or share comments and thoughts in the chat box. We'll be monitoring that as we go. And again, we will end with some live Q&A after our presenters have a time to share their presentations today. And the webinar is being recorded and slides and materials will be made available afterward. So just a quick thank you to our presenters from webinar 1. I think we have Tiffany Lozada from the Porch Band of Creek Indians on the line today too as a participant. So Tiffany, welcome and thank you again for all the insights you shared on webinar 1. And same to you, Sydney, thank you. And we're looking forward to hearing from you again today. The webinar recording should be available later this week from webinar 1 and hopefully webinar 2. So keep an eye on your email inboxes for that. So I just wanted to kind of recap some of the key takeaways that I had from webinar 1. And certainly if you were on that webinar and had some additional comments that you wanted to share, please feel free to throw those in the chat box. We'd love to hear what you took away if you were in that webinar as well. So a few just key things to kind of get us started thinking about healthy homes outreach and innovations today. Some of the things that I heard on our first set of presenters were what's listed here. So one key thing takeaway was to set up a brainstorming session. This has been something that we've done with a number of tribes in Region 10, and I know elsewhere too, like Tiffany's work in Alabama, was to get started by setting up a session with either other tribes who have done this work or organizations who can provide support like EPA, Tribal Healthy Homes Network, organizations like ITEP. Feel free to reach out to us and we'd be happy to set something up. Additionally, when you're thinking about building your programs, a takeaway I heard was that thinking about people that you haven't worked with before and approaching them to see how you might have some synergies is a really good place to start. So I know Tiffany worked with family services programs. Other tribes have worked with their elders programs or their school staff, principals, or teachers. There's just a number of different creative ways you can adapt to reach your community. And another thing that we learned is that there isn't just one source of funding that can be used for indoor air quality or healthy homes outreach and intervention. So thinking about looking at a mix of different funding sources and braiding them together seems like the most viable option for accomplishing your goals. And I'll share a resource for looking at funding in a minute here. And also, depending on the number of different hats that you wear and the different program activities that you already have going, we heard from our presenters last time that often it can be helpful to start small, either with a smaller number of tools or a smaller number of participants that you're hoping to reach with your program, and then grow from there depending upon your capacity and what you learn along the way. I have one more slide about wisdom from webinar one, and here we go. So there are a number of different outreach materials that already exist in a ton of different areas, anything from green cleaning to wood heating. There's really just a gamut of materials that you can tap into that have already been created. And so we heard from Tiffany and from Sydney that a number of tribes have already had a lot of success in adding their own photos or logos, contact information, or art to existing outreach materials to really make them personalized and of interest to the community. Tiffany also had some great examples of how she made the Healthy Homes kits that she put together really user-friendly by adding stickers on the outside of the boxes and color-coded text to make it really easy for people to see what they needed to do with the different tools that were provided and in what order. So just making it really easy and fun. And one of the things that I also thought was interesting, and we heard from a number of folks, was that green cleaning is one of the topics in the Healthy Homes world that really seems to be a good conversation starter. So if you're having trouble connecting with people or just want to find something kind of neutral ground, safe, if you will, to talk about, people often are really excited to talk about green cleaning and have ideas or want to share what they've done before, that kind of thing. So if you're looking for a place to start, that often is a great one. And word of mouth is powerful. I loved hearing Tiffany's story about how word really spread about the Healthy Homes kit among elders. And rather than having to recruit all the time, sometimes people come asking because they heard from their friends or neighbors about the tools that are being provided. And I think we closed out again with a great tidbit from Tiffany that having a plan B, C, and D is often helpful, and just being flexible with your programs because you don't know what the world is going to throw at you, whether it's your supplies not arriving on time for your presentation or different restrictions during the pandemic. There's just a number of different types and levels of challenges that may pop up. So being flexible and kind of expecting anything to happen seems like a really great perspective to take on. So this again is just a key recap of some resources we talked about in more detail on the first webinar. So if you're interested in these, please feel free to tune into the recording or reach out to any of us with questions. A few things that I highlighted here are the Tribal Healthy Homes Network training and technical support resources. So if you look at their website, thhnw.org, you can find a number of these resources, as well as the Tribal Indoor Air Funding Directory. Please take a look at that. It's really comprehensive and updated regularly, and we'll drop a link into the chat box for that here in a bit as well if you'd like to take a look. Please also reach out to EPA staff in your regions to find out about the different outreach tools and trainings and resources that we have that can be used by your tribe or organization, and also to do some brainstorming around existing EPA grants that you might receive, such as IGAP or Clean Air Act or environmental justice grants, and how those could potentially be used used for indoor air and healthy homes outreach. And again, lean on tribes and tribal organizations and the work that they've done. That was really our main goal for these this set of webinars, is to put out some of the great work that tribes have been doing, especially during extra challenging times, and to find ways to innovate, adapt, and adopt those programs. ITEP and NTHC in Alaska are also excellent resources. So with that being said, I'm going to turn it over to Gillian. Please do sign up for webinar 3 next week. We'll make sure to put that information in the chat box as well, the third registration link, as well as contact information for all of us as well. So with that, Gillian, I'm going to turn things over to you.
So I'm just gonna, whoop, there we go. Quick transfer. All right, good morning and good afternoon. I believe everybody should be able to see my slides, although thanks to the brilliant software being used, you actually get to see my second slide as well, no matter how many times we adjust that. So anyway, good morning. I just, again, I'm going to speak very briefly. I want to get into our speakers today so you can hear their stories and their highlights. I'm the director of the Tribal Healthy Homes Network, and I also manage the Partnership for Air Matters, which is the organization that, if you were on last week's webinar, I may have mentioned, but we are the program that assembles, ships the toolkits, does the technical assistance and the training. We're a nonprofit organization in Washington State, and we assemble and ship them at cost. And then Tribal Healthy Homes Network covers our expenses for all our training and technical assistance. So just in case you're wondering the relationship between those two organizations, wanted to explain that's how we operate. Very briefly, just a few things.
You're breaking up just a little, sorry.
Oh dear, okay. Not much I can do about that. Is that any better?
It is better. It's just once in a while. So maybe, yeah, just go slowly and we'll catch most of it.
It will help. All right. I just want to start before I begin and thank the Tulalip tribes. These are some pictures of friends, children, and grandchildren. And the Tulalip tribes have, since Tribal Healthy Homes Network was established, have been the host. They support our organization, and they also are where we do a lot of our pilot work. So I wanted to explicitly thank them. Just a reminder that at the end of each webinar today, today, including next week, we'll be raffling off a full toolkit, sending it to you. And that for those who complete and participate in all 3 of the webinars, we'll also be sending out a certificate of completion. We do have the recorded versions of the webinar, so if you missed last week, we will be sending that out probably on Wednesday. If you were registered, you'll receive a copy of that. Or you can just reach out to us and we'll send it to you. Erin, how's the audio?
Good.
Okay, all right. Just a few more points here. Just to step back for a minute and emphasize that the purpose of this webinar series and a lot of our work and interest around indoor air is that if we cannot effectively communicate the risks, which are often invisible, odorless, and tasteless, we're going to have a very hard time encouraging either behavior change within residents or to get our clinical staff and our pharmacists and childcare facilities and our housing departments to change any practices with how they maintain or build or operate a building or a home. So probably one of the most important parts of our work is to explain and convince people that a risk exists and how to measure it, observe it, and address it. So you know, as an example, many of these things exist within a single family home, within multifamily homes, within workplaces. It varies, but almost all of these are invisible and odorless. And as I mentioned last week when I talked about social marketing, was the idea that in order to get people or departments or programs to make behavior change, it often is more successful when people are solving the problems independently versus being taught. And that when they're working hands-on and when they're seeing something, we're all more likely to be a little bit more engaged. So a few principles of that, I described these last week, is just active participation in the learning process is more effective than passively receiving knowledge. You know, discovery learning and hands-on requires people to sort of ask questions to expand their thinking. explore their own answers, and generally it produces stronger learning outcomes, meaning, when we learn on our own, when we discover something on our own and problem solve, we're more likely to have that knowledge be embedded. And I shared that with social marketing, but that was the rationale in part behind the Air Matters toolkits. I won't go through this, but if you're not familiar with them, you'll learn more about them today. These are the tools in the kit on the right, as well as future tools that we're looking at. And again, just as a reminder for those of you who are new to the toolkits, they're not a replacement for an in-home assessment, though they are often used and can complement an in-home inspection. Repairs and mitigation need to be done, but then when they're done, for example, we see housing departments bring in the kit as a way to reinforce certain things for the resident to do. And they're not a holistic intervention. They often need to be supplemented with other efforts, such as patient education on asthma medication. We do advocate that using tools, whether it's your own toolkits that you've created and assembled, whether it's the Air Matters kit, but they're very useful when trust is a barrier to entering homes, and you may have encountered that. Whether you're part of our tribal audience or we have many non-tribal partners who use the toolkits and who we work with, in many cases, of course, they're just homes you cannot access for a variety of reasons. And the tools help people learn on their own about the risks. And of course, toolkits are very useful when there's limited staff time and resources and you can't personally reach every resident. And then, the tools actually are one way we can try to make indoor air quality real, because as you know, there's sort of the axiom is if you can measure it, it actually exists. Just close with this slide showing some of the tribes and communities that have helped distribute over 1,800 toolkits since the program's inception. And then I'm going to just stop here because that's where I announce the raffle winner. We have a couple polls we'll also do at the end. So I'll go ahead and mute myself, and Erin, if you want to go ahead and move us over to Cindy Jansen.
Will do. Thanks, Gillian.
Hello, everyone. Can you see my screen just fine?
Looks great and sounds good. Thank you.
Awesome. So thank you for letting me be here today. My name is Cindy Jansen. I am the Air Matters Program Evaluation Intern for the Tribal Healthy Homes Network. And today I'm going to recap some information from last week and dive deeper into the innovation, successes, and lessons learned from the Air Matters Toolkit. So to recap from last week, with my research, I wanted to understand the tribal and agency experience to strengthen the Tribal Healthy Homes Network support. And in addition, I wanted to hear about their innovations, successes, and lessons learned from the Air Matters program. And I'm happy to share that information with you all today. So in total, my data set consisted of 16 representatives from tribes and agencies that I conducted semi-structured interviews with. And to be eligible for this evaluation, they must have been a tribal staff member or an indoor air quality professional, as well as having ordered and distributed the Air Matters toolkits or implementing their own toolkit program. And so reflecting on my interviews, I found 4 key themes. The first being that people adapted the toolkits based on their community's needs by adding in additional tools or taking specific ones out. Second, I also found that programs specified their methods and goals. And what I mean by that is that programs clearly identified their goals, whether it be to educate or to intervene, and chose the appropriate method that fulfills this purpose. So if you wanted to spark conversations and introduce indoor air quality, education and outreach was the way to go. Whereas if you wanted to distribute the toolkits, intervention was the way to go. I also found 2 factors that influence engagement methods, which is the program type, so education and outreach or intervention, as well as the recipient interests in the toolkit itself. So if they are interested, you might delve a little bit deeper into the pieces of the toolkit, whereas some people might just want to walk away. Lastly, I found some intensities of the engagement that had varied by each program. So some had high community engagement where they demonstrated each toolkit and answered a lot of questions, whereas others were low intensity. So to go off of these 4 themes, we have seen several innovative approaches to the Air Matters Toolkit. The first being that there's a wide variety of populations, channels, and programmatic efforts who have interacted with this kit. So as we can see with the green parts of this image, these are the different methods of distribution or community engagement. So we have health fairs, schools, hospital discharges, raffles, Meals on Wheels, community engagements, the Temporary Assistance for Needy Family Program, HUD, Mold and Moisture, weatherization programs. The blue is the different target populations that they have reached. So people with asthma, youth, elderly, homeowners, renters, tribal residents and members, and then the gray are the different program types, so education and outreach as well as intervention. So one of the most interesting innovations is how people use the Air Matters Toolkit to spark conversations. For tribes who use the toolkit as an outreach and education tool, they initiated conversations about indoor air quality to people who might not know much about it. And they also encourage people to ask questions about indoor air quality. One staff member that I had talked to mentioned that they were able to answer questions about indoor air quality that people might not open up to unless you had built up that rapport with them. And lastly, these conversations, they were able to illustrate the importance of indoor air quality and its impacts on health. So what were the successes of the Air Matters Toolkit program? So for starters, if we look at this chart for the intervention programs from a quantitative perspective, we can see that in this sample, over 90% of the toolkits ordered for intervention were distributed. And we also see successes in how broad of a reach programs get by partnering with other departments. And by utilizing your connections, the programmatic efforts were able to create the greatest impact possible. And in some cases, tribes had used these partnerships as a means to distribute the toolkit. So whether it be through HUD as a mold intervention, or as we've seen with COVID-19, one tribe used the toolkits with other departments to distribute them. And some overall impacts of the community and indoor air quality work. Each person said that they had a great experience with the toolkit. They enjoyed the cue cards and found the toolkit as another way to outreach, educate, and intervene. And several people had told me that even if the toolkit had helped just one home, then they would consider that a win. And I found that to be very interesting and hopeful because we don't have to quantitatively measure success by how many people you've distributed the toolkits to or talked with. At the end of the day, if you can just help one person, then that is success. So what are our next steps moving forward and how do we learn from this evaluation data? Many indoor air quality initiatives adapted the Air Matters Toolkit to fit their needs of the community. So people had introduced new tools such as buckets, tote bags, or humidifier bags, whereas others took out specific tools such as the pest control kit, radon kit, or hydrometers. So moving forward, it's learning about how we can adapt based off of these communities' needs, because for one, the indoor air quality issue may not be as prevalent, or specific tools may not be practical to distribute. We also learned from a tribe who's raffling the toolkit pieces off as prizes, and this was great because the tribal members and residents were able to self-select which tools they wanted. And what we found in this community was that the high interest tools were the hydrometers, chimney thermometers, and the radon kit, whereas the low interest tools were the pest control kit, as well as the allergen pillowcase. And I just want to acknowledge that all of the pieces of the toolkit are still important, but this shows how people select what is most important and what they perceive indoor air quality to be. Moving forward, we also hope to work with the tribes and agencies in implementing behavior change assessment and evaluation tools, because only 2 people that I had spoken with had distributed surveys or follow-up conversations, and by implementing this measure later, we would have this raw data for behavior change. Lastly, we found that funding could serve as a determining factor in your method of community engagement. So some budgets allowed for tribes to purchase 1 kit for educational purposes, whereas others were able to purchase more to distribute. And there's also the component of whether or not you wanted fewer kits with all of the tools or having more kits with fewer tools in them. However, this shouldn't be treated as a constraint because programs can be successful either way. As Erin mentioned earlier, It is only one component of your broader indoor air quality work and community engagement. So thank you all so much for your time.
Thank you, Sydney. That was excellent. Looking forward to some more Q&A about that later. I'm going to now turn it over to Brooke.
Thank you, Erin. Can you see my screen? Whoop. There we go.
Looks great now. Thanks.
Okay, great. So good morning, everyone. As Erin said, my name is Brooke Sanderson, and I'm the environmental coordinator with the Loudoun Tribal Council in Galena, Alaska. I'm excited to talk to you guys today and share our experiences with outreach activities during COVID-19, specifically around our own Air Matters Healthy Homes program. Next, there we go. So just a quick background, Galena is located within the Alaskan interior. We're about 300 miles off of the road system. Goods are shipped by small plane year-round, or there is a barge that'll come down the Yukon River from June to August each year when there's no ice on the river. There's internet available, but it is really expensive, and it's better in some areas than others, so not everyone has access to that. Houses are built tight to keep the cold out during the winter, which regularly gets down in the -50s. And in the summer, road dust pollution is always a major concern here. The Loudoun Tribal Councils worked for years with the city of Galena to reduce road dust pollution. And during FY21 in our IGAP program, they decided it was time to shift some of our outreach efforts to highlight the importance of indoor air quality. We developed our FY21 work plan in January of 2020. And then a short time afterwards is when everything started shutting down due to COVID-19. And then by the fall of 2020, before we were going to get started on that work plan, it was really clear that we were going to have to get creative if we wanted to carry out our work plan commitments. What we hoped to accomplish during this last year was to conduct a community survey to learn more information on the indoor air quality concerns that people already had. Based on those surveys, interested households would receive a customized Galena Air Matters toolkit. And then we would do a survey at the end to check in on how we could improve the program in the following years if it were to continue. So we had to figure out how we were going to accomplish our commitments in a safe way. The indoor air quality outreach and education was really more important than ever since indoor air quality and COVID-19 had such a direct connection for people's health. But because of the risk of conducting outreach, we had to consider some factors. So in Galena, our office was not teleworking, but we had to be ready to in case a case popped up. There were no in-person events taking place where we could distribute the surveys, as everyone was encouraged to shelter in place whenever possible. Meeting with people in person, especially people that had indoor air quality concerns and may have pre-existing conditions, seemed really irresponsible. And at the time when we were making these plans, there was no vaccine. So the first thing I did was reach out to my EPA project officer because I have a healthy amount of education outreach activities under my belt, but anything that wasn't, direct contact with people was a flyer, and that wasn't going to work in this case. So Erin's already mentioned all of the resources that I have listed on this slide. And there's a ton of wonderful people and more resources that she mentioned that these people are more than happy and excited to help with your projects as they were with mine. So between their insights and recommendations and using the existing knowledge of our local residents, we created a project plan that included COVID safe outreach that was ultimately approved by the EPA as a quality assurance project plan, or QAP. And the first step in that QAP was to conduct a baseline survey for community members to express their indoor air quality concerns and learn more about their needs. Typically, I would like to have this type of survey at an event with a table, so I can encourage people to fill them out on the spot, but that wasn't possible with no community events. So we advertised on our local radio station, which is the main way that people learn of things going on around town out here. We had hard copies available at public spaces like the post office and the store. And I gave about a week and a half for people to fill out the surveys and return them. And we also had copies online if that was preferred and they were able to fill them out there. So we gathered some really great information from those, as you can see on this slide. Ventilation, moisture and mold, and wood smoke were the top 3 most common concerns. We did only receive 17 surveys, but out of those, 14 households were interested in participating in our Healthy Homes program. So the upside of that was we had enough funding through our IGAP program to purchase these toolkits for everyone who wanted to participate. So after reviewing the surveys, we ordered the items for our toolkits. I was concerned on how to review the items with the participants if we couldn't sit down in person. Not all households have internet, like I said, so Zoom meetings weren't always possible. Creating a video and putting that on a flash drive was suggested and is a really good option, but I also worried that some people we were trying to reach wouldn't have access to a computer. And explaining the items over the phone might work pretty well, but I always like to have a hard copy of information. So I created a guide where the information was coordinated with the numbered items in the kit. So for example, in this photo, you can kind of see that item number 3 is an allergy pillow cover, and it corresponds with number 3 in the guide, dust and dander, where you can read all about using that item and some other ways to control that pollutant in your home. That way I could really easily reference the guide when speaking with people over the phone. Here's some other examples. So the bucket with the green cleaning items had number 4 written on it. There was information about carbon monoxide, and then I also included a hygrometer with some experiment ideas on monitoring humidity in your home. And this also allowed for some flexibility where if restrictions relaxed, I could easily adapt this system and I wouldn't have put a bunch of time and energy into videos that I didn't end up actually needing. And it also allowed for some flexibility depending on the comfort level of the participant. And then in late December, the vaccine became available, and by late February, Galena was quickly approaching herd immunity. However, there were still concerns because the children still weren't vaccinated in the schools, and with new variants, we continued using masks and monitoring travel. So I decided to leave it up to each participant. Would they like to get their kit in person, or I could drop the kit off and call them and explain the items with the numbered system in place. Nearly everyone came by to pick them up in person, but this system was really easy to adapt depending on their situation. And then really quickly, we will be distributing our follow-up survey in the next month or so, but I have received some verbal feedback. Right away, somebody turned in their survey and said, I knew that my carbon monoxide and smoke alarms needed replaced, but I keep putting it off. I called Joey's, which is the hardware store here, and they're waiting for me to pick up my new alarms. And so that was awesome. Someone else has been using their hygrometer and noticed that their vent fans in their bathroom, which they thought worked really well, actually don't seem to be moving much air, and it's really increased their awareness. And they had another person say, "This is a lot," and I'm not sure if that's good or bad. Another participant said they thought they won a raffle, so I took that to mean that they got a lot of items that they were really excited about. So maybe that's what this person also meant. But I also wonder if they meant it's too much and they felt overwhelmed. So I'm hoping to gain more information on that once I talk to them and give those follow-up surveys. So just a couple of reflections. Maybe if we had mailed everyone the survey, we might have gotten more responses. Maybe not. As we start to have more in-person events, I can still bring those there and see if we can get some more feedback. And then I also wonder if maybe we should have given the kits in pieces. That way they could learn one item at a time and focus on one issue at a time instead of possibly feeling overwhelmed with all the information at once. And that's all I have for today. Thanks for having me.
Thank you so much, Brooke. That was excellent. I really appreciate you taking the time to share all of your experiences, and please do stay on for some Q&A. If folks have any questions or comments, please do throw it in the chat box. I am now going to turn it over to Eileen Gagne for her presentation.
I am, let's see, the presenter.
Yes, I can hear you, and I see a beautiful blue screen.
Oh, lovely. Let's try this. Okay, how's that, Erin? Better?
Perfect. Go for it.
Great. Well, welcome and thank you everyone for joining us. And first off, I want to acknowledge the Native peoples on whose ancestral homelands we gather, as well as the diverse and vibrant Native communities who make their home here today. And thank you. What I am Eileen Gagne. I am the technical advisor and trainer for the Tribal Healthy Homes Network. And I have been working for Gillian Ho a long time and have trained many, many villages and tribes and folks throughout the country on on a lot of things, including the toolkit and indoor air and everything that encompasses. So today we're going to talk about conversations, thoughts, and the unexpected results of the toolkit. So I'm trying to make this go forward. There we go. So as you all know, or if you didn't know, you're going to find out, the program approach is a low-cost, hands-on method to help move residents and patients along the continuum, from education to empowerment and from knowledge to action. And just for a little background, I've been working with people in healthy housing issues for about 40 years. And indoor air, as you probably all know or are going to know, is a tricky subject. And it's one of those subjects that's very hard to talk about and to educate and to really implement some behavior changes on. Oh, where's she going? There we go. The tools in the kit specifically were selected based on the guide. We spoke to housing inspectors, air quality specialists, asthma educators, community health workers, and from the residents themselves as to what tools would be most helpful and what would work. On the housing side, so we've worked with different kinds of housing staff from all levels, and really between the housing staff and residents, they're both looking for ways to create a relationship, to create a partnership, so that everyone can take better care of their housing. So in terms of innovations, in Cherokee, North Carolina, I did a 3-hour indoor air quality and toolkit training at the local K through 12 school. And to all the teachers, once it was a 3-hour, it was lovely, great training in their school. They distributed the kits to those students or to students' parents and guardians who they felt could really benefit from the kits. And the tool recipients were given an incentive to return the follow-up survey by entering a drawing for a HEPA vacuum. Now that was an interesting technique to try and get some surveys back. And then in terms of innovation, some energy efficiency work, we partnered with the Bonneville Power Administration to promote a more efficient heating for tribal members, changing out electric baseboard heat or wood stoves to heat pumps. And the board was so impressed by the work that they matched the grant funding from BPA so that more elders were able to be served. And they also received toolkits and education along with the heat pumps. And then as well, Snohomish County provided additional toolkits to eligible households. And then in terms of Tulalip, there's been lots of ways that I've worked with that particular tribal community. And between the pharmacy and the clinic, there's a lovely collaboration where the pharmacist actually can hand out kits as well as additional asthma supplies to asthma and allergy patients, to children with respiratory issues, those folks that they really deem are, most needy and actually are quite sensitive to air quality issues. And then targeted outreach, done lots of health fairs at Tulalip's Taylor Early Learning Academy, where the whole academy is they turn it into one giant health fair. And folks come when they're picking up their kids from school to go around to each of the booths and get all sorts of great information, including our toolkit and what green cleaning recipes are always a big hit. And then on that particular slide, you can see the calendar that Erin mentioned that we have handed out, and all sorts of green cleaning recipes stapled to microfiber cloths, which are a great way that I found to hook people in to start the conversation at these health fairs. And then in terms of the communities that I've traveled to all over the country, we have the community-wide training and participation for Nunapachik, Alaska, where I flew in, provided indoor air quality training, not just for a few people, but for the entire community. We gathered in the gym and went through the kit and talked about the tools, what's in the kit, what their issues are, what they're for, what they can do, and how important they are. And what was interesting about that one, they actually started a discussion about climate change. So this is, the toolkit not only is a gateway to understand things that they can do for their indoor air and their healthy homes, but also other issues that could be on their minds. And then, oh, why aren't you moving forward? Sorry, having a glitch here. Oh, where is she gonna go next? Okay, sorry. And then these two communities, so Unalakleet and Sandpoint, Alaska. So in the first one, I went up and I actually called the principal because I was going to be up there in the community for a day or two. And I said, I'm coming up and bringing all my tools. How would you like an indoor air quality assessment of your school? And first he sort of hemmed and hawed, and then he remembered how important indoor air quality is for school, for student scores on tests. So he allowed me to come in and I did 3 different air quality monitoring for carbon dioxide, temperature, and humidity. And I did it 3 different times, one at 5 at night, 5 in the afternoon after the students had gone, 8 in the morning before they got there, and then 2 o'clock in the afternoon. And what we found is that in 7 of the 10 classrooms that I went into, the CO2 alarm went off, which indicates a high level of carbon dioxide. So that was an interesting thing, and given our now challenge with COVID-19 makes it even more relevant. And then with Sandpoint, I went there as well and did a community presentation, small one at, in the afternoon after work, and actually had to leave early because the volcano was going off. So you never know what you're going to get at these. And then in Wainwright, Alaska, I'm working with an IGAC coordinator she's working with the science teachers to integrate the tools into a high school curriculum. So that's a different way of engaging students and folks in the kit and the importance of indoor air quality. And then in terms of the future and a pilot project, this is what we're doing. So carbon monoxide, the silent killer. Well, what is carbon monoxide? Well, carbon monoxide is a poisonous gas that is odorless, colorless, and tasteless. So where does carbon monoxide come from? What are the sources? Oh, so there are many sources of carbon monoxide. One could be your car, your truck, your four-wheeler, your snow machine, anything that burns fuel to operate, you store inside. Or your gas or charcoal gas grill, hopefully that you're cooking outside, as well as maybe your fireplace. In the wintertime, you light a fire, keep it nice and warm and cozy in there. Could also be your oil, gas, propane furnace or water heater, and anything that burns fuel, as well as your portable heating devices, such as a propane or in this case, a kerosene heater. And then maybe your wood stove, your pellet stove, or your Toyo stove. And then also any portable or stationary diesel generator, anything, as I said, that burns fuel. And of course, your gas or propane or wood cook stove. So how is carbon monoxide made? So this is a pilot project we're working on. And in any case, we look forward to any questions you may have at the end or now. I think probably at the end, considering our time limitation. And once again, thank you again. And I'm Eileen Gagne, Technical Advisor and Trainer for the Tribal Healthy Homes Network, available to assist anyone at any time with any questions. Thank you.
Thank you, Eileen. That was an excellent presentation, and the first time I've seen those videos with the drawings. Really cool. I'm looking forward to seeing that tool as it develops. I am turning it over to Gillian now, who is going to do some poll questions and a raffle, and then we will open it up for questions.
All right, I'm going to try to do these quickly. And Brooke and Eileen, thank you. I just so appreciate your creative, innovative, and persistent work in the field, and it's exciting to hear about that. So hopefully you all can see this brilliantly beautiful slide with the word polls.
Yeah.
I'm going to go ahead and administer these really quickly and launch them. You'll just participate. You'll see it should just give you the option to go ahead and input your answer. And this is just to get a better understanding. And I'm going to launch the first one. And you can, in this first one, please select 3 of the 4 that are the most helpful ways that you learn when you're needing to learn something technical, challenging. Okay, I'll leave it open for about 15 more seconds. All right, I'm going to close that poll and share the results of that. So it looks like seeing, and it's very small on my screen, but I think what this illustrates is that all 4 methods are actually useful to most people, and that we don't learn from just one way. Also that visual is very powerful. And I share these just as a reminder that IACUE outreach requires that we marshal all resources in all ways possible. All right, I'm going to hide that and see if I can share my next question. All right, and it should say, what learning methods have appeared to be most effective in your IACUE outreach with people? So in the work that you've done, you know, again, whether you are working directly in a community or whether you're administering grants and supporting tribes, but if you can just select your top 3. Okay, give it about 5 more seconds. All right, and it looks like interesting. So that one's also pretty widely distributed, which is good to know. And it also indicates that many of you are using a variety of techniques. Okay, 2 more questions. So Eileen just shared an illustrated video, and if you've used our toolkits or done your own, you've seen that we do print materials. So we're trying with the idea of an illustrated video, which is what Eileen just shared, so that there's a visual and auditory side to the learning. And I'll just say, if everything goes well, there would just be a QR code taped to every tool, laminated. So when people get the kit, they just open, or you could just create your own, but they open the QR code, run their phone over it, and the video starts playing. All right, I'm going to go ahead and leave that open for about 3 more seconds. And we would love your feedback as we start to do this pilot. So I'm going to close, share that. So about 58% very likely, 42% somewhat likely, which is, I'd love to hear if anybody has any direct feedback that we work with on what would or would not be useful about it. And then last question very quickly, if we were to do the illustrated videos that are narrated in different languages, and you know, whether it's Yupik and Navajo, possibly Spanish, would that be useful? Okay, about 3 more seconds. All right, and again, I'll just close that, share it, and it looks like there's mostly somewhat useful. And I'd love to hear more from you at conferences or in events. Feel free to email us with why or why not that might be of value in your program. So I will also close my section before we go to questions really quickly to say congratulations to Peggy. I think it's Moss, I'm not sure, but with Kootenai, and congratulations, you're the raffle winner. And we will be in touch with you. And also thanks to ITEP. I wanted to mention that They have just an incredible internship program for air quality, and that's one way Sydney came to work with Tribal Healthy Homes Network. Thanks to them. And Erin, I'm going to go ahead and mute myself and let you take us into questions.
Sounds good. Thanks, Gillian, and congratulations to the toolkit recipient. I'm just going to go to, I know we have a few questions we wanted to ask the presenters, but I'm going to quickly go to the list that we've received so far. And let's see here, a couple of questions for Brooke, and also just kudos for your excellent presentation. Brooke, did you create the infographics in your pamphlets for the kits yourself, or were those something that you adapted from another resource? Sounds like they thought this looked great, and also gave you some kudos for using the numbering items corresponding to the infographic method, and thought that others would probably want to use that method too. So anything you'd like to share about the infographics and how you developed those or adapted those?
Sure. Yeah. A little of both, I guess. I took ideas from, pamphlets I'd seen online or information from other organizations. But I did create all of those, and I don't know, Erin, am I allowed to plug the website that I used for that?
Sure.
There's a website called Canva, CANVA, and they have a lot of free graphics and things that you can make posters, flyers, and I just used it in this case to make that pamphlet.
Thank you. And yes, they have a lot of free options too, which is great.
Yeah.
Okay, let's see what else here. Another participant asked if you had, this is for Brooke, if you had mailed out the questionnaires, would you have asked the participants to mail their answers back for the surveys?
That's a good question. I think we didn't make it that far just because we had decided to just go with placing them at public places and having them available online through the radio station's website. But in the past, I've done mail-in surveys and I've provided the postage back. And I found that was pretty successful. It just gives people one more reason to send it back in because it's already paid for.
Right, thank you.
Mm-hmm.
Another individual asked, what tools are available to address low literacy? It's a great question, and I feel like there were a couple of examples shared, but I'm just going to pause and open it up to any of the presenters. And this is Erin. I guess one thought that came to mind is the video tool that is being developed by Tribal Healthy Homes Network is a great resource, and also the infographics that Brooke created or could be adapted to be less text heavy and more picture heavy. Any other thoughts on?
Erin, this is Eileen. I think both of those ideas are excellent. And maybe, not only low literacy, but also folks that, English is not their first language or have, can have a very difficult time understanding, some of these concepts are quite abstract, like carbon monoxide. It's just one of these things that's just like, what is it? It's an invisible gas. Well, how do I know it exists, right? So, that is really the point of the videos is to, provide another level of education. And a lot of people, including myself, I learn better with the visuals rather than, just reading. And pictures, it's kind of fun to watch the hand go and the sketching and see what the person's going to do. So it definitely brings that into a different level for folks. And yeah. So.
Thanks, Eileen. And I know we're just kind of rounding out the end of the hour here. I don't see other questions. If anybody else does, please chime in. Or if you have any more, please throw them into the chat box. I guess one question I do see is, will the slides from webinar 1 be made available? And the answer is yes, as well as the recordings. And I guess before we close, I'm just curious, Brooke and Eileen, if there are any last kind of recommendations or lessons learned that you'd like to share with tribes or other organizations who are interested in doing Healthy Homes outreach or adapting programs they've heard about today.
Brooke, do you want to, you did an excellent presentation. Thank you on all the ways that you were able to adapt and, you know, be quite successful at that. And, you know, I think, like was stated before, is being as flexible and as open as to, you know, all sorts of different options that you could use within your own community. What works for your community may not work for somebody else. So, you know, there's always a plan B, C, D, and E. And I think, and with COVID, certainly that has challenged, you know, a lot of our outreach, but in some cases, you know, maybe you know, it's given us the ability to access things in a new way we hadn't even thought about. So, and, you know, certainly the information regarding indoor air has become much more important, which, given that it is my my main goal, I think it's great. But if anybody has any questions, certainly they can contact me about any issues at all. I thank you.
Thanks, Eileen. Brooke, any thoughts?
Yeah, I just, Eileen said it perfectly. Just be really flexible. And then also, you know, listen to people in your community on what would and would not work, but also be creative. And then also, like I said, consider that people are going through a lot right now, and adding more and more stuff could be possibly overwhelming. And so just consider that when you're coming up with these plans for outreach. It's something I wish I had taken more into consideration.
A very good insight. Good point. Thank you, Brooke. All right, with that being said, I just wanted to thank everyone for joining today. We hope that you will sign up and join us for webinar 3, which is happening next Monday. And if you haven't already, we'll make sure to share recordings for webinar 1, and hopefully you'll be able to participate by listening to the archive of that, because it also was full of great information. If you have any questions, please feel free to let us know. We'll be following up with an email. And again, thank you to our presenters. And we hope to be joining you all again next Monday for another presentation, or set of presentations, I should say. We'll be having Lucas Bear with the Spokane Tribe sharing his work, as well as Aksenia Odeman with the Alaska Native Tribal Health Consortium sharing work that she and Abby Nelson and colleagues have been doing in Alaska. So thanks again, and we hope everyone has a wonderful day.